Bismillahirrahmanirrahim. Welcome to Medical Globe e-learning. This is Mustalim from Shaikhal Medical College. So now today's our topic is chapter 9 of heart. And first of all, you have to know its tools. There are 14 MCQ and 2 SAQ from this section. Now starting with the chapter, here are some important highlighted points for MCQ. Now on the next side of the page, this one and this one is also important for MCQ. On the next page, you have to know about the action potential in cardiac muscle. Its steps all are highlighted with yellow, which is important for SCQ point of view. Now the summary of phases of action potential, it is also important for SCQ and MCQ point of view. You have to know its phases, phases 1, 2, 3, 4, all. And next this one you have to know the velocity of conduction. It is important for MCQ point of view. Again this one. And the next SCQ is excitation, contraction, coupling. It is very important. You have to know its steps. All are highlighted with yellow. This one. Next, you have to know the duration of contraction, that is 0.2 in atria and 0.3 seconds in ventricles. Now, this diagram is important to draw and label in excitation contraction coupling. The most important UQ of cardiac system, it is cardiac cycle. It is very important. You have to know about diastole, systole, and its definition of cardiac cycle. This diagram is very important. You have to know how to draw and label it. Next, it is about P wave, QRS and T wave. It is important for MCQ. This blue book is very important for SCQ and UQ point of view. You have to know about A wave, C wave and V wave. Function of ventricles as pump, it is also very important for SCQ point of view. You have to know its phases. Then end diastolic volume and systolic volume, stroke volume output, it is very important for SCQ and MCQ point of view. Next, here are some important highlighted points for conceptual purpose and for MCQs. Now, heart sound, it is very important for SCQ point of view. You have to know first, second, third, fourth heart sounds and their origin and their characteristics. Now, work output of heart, you have to know its definition. But this block is not as much important, so you have to drop it. Next is the volume pressure diagram. It is important for CQ point of view. You have to know its phases. This one. And this diagram is important to draw the volume pressure curve. Next is the preload and afterload. It is very important for CQ point of view. And the chemical energy utilization of heart, it is important for MCQ point of view. And again, this blue box you can drop it. You have to know about the efficiency of cardiac cycle. And the next MCQ is the regulation of heart pumping. You have to know about the Frank-Starling mechanism, its definition, this one. And on the next page, you have to know about the control of heart by sympathetic and parasympathetic nerve supply. This topic is important for SCQ point of view. The effect of ions like potassium, calcium, it is important for MCQ point of view, effect of temperature on heart. And our chapter is end. Hope so you can understand. For better preparation of Prof, you can avail services from Medical Globe Book MBBS Cracks. Thank you. Allah Hafiz.
Medical Globe brings you the solution to your problems, the problems you face during your professional exams. Yes, we are introducing MBBS Cracks. This book contains chapter-wise important topics along with solved past university questions, and important Viva questions are also given to ace your Viva. Besides this, chapter pearls are also given histology diagrams along with OSPI model pictures in high resolution are mentioned in this book. Besides this series for SCQs, we have also introduced our series for MCQs, that is MCQs Cracks. This book contains MCQs not only from UHS but also from several other universities. So what are you waiting for? Go get this book ordered at your doorstep by ordering at our given number, that is 0335 6633 007. Thank you.